20 years ago, I was diagnosed with psoriatic arthritis. And like everybody else, I had a very excellent health insurance through my wife's work, which I never used before.
Mm-hmm.
So I asked her to help me find the insurance card. And then I booked an appointment with a local dermatologist, and they gave me an appointment a month in advance, which I found already a little bit peculiar,
Mm-hmm.
For the best healthcare system in the world. So fine, whatever it is, I waited for my appointment. It was an emergency. And then I came to the office. I waited in the waiting room for another hour. And then they put me into exam room for another 20 minutes. And then the doctor walked in, asked me what the problem was. I told them, I just pointed to the side of my head. That's where my psoriasis was beginning. He looked at it, he said, okay, you have, psoriasis, and here's some steroid cream. Try it and, see how it works. If anything, give us a call back. And that was it. He was gone in less than 3 minutes. So I took the steroid cream and I put it on my head and it cleared up. So I was like, okay, problem solved, moving on to doing what I do, which is, build businesses and create companies. But then in a few days, it came back and it was worse. So I put more cream on. It was a steroid cream. And so it went away and it came back worse. So it's, eventually 60% of my body was covered with psoriasis. And my joints hurt so bad I could barely walk. I was in my mid-30s. So that became very distracting to me. And at the same time, it became very insulting to me. I trusted this system to take care of me in the way that I imagined I would be taken care of, which is going to solve my problem. But unfortunately, this almost $5 trillion disease management industrial complex is only interested in managing the condition for the duration of my life with steroid creams and methotrexate.
Right.
Which, as you know, is a chemo-like drug that suppresses the immune system with a potential black box warning of rarely fatal infection.
Yeah.
So this got boring very, very quickly, and I decided that I wanted to find the resolution to my chronic health illness, and that's where my journey begins.
Okay. Well, that's it's an interesting entry point. I think so many people that have come into this space of health optimization, functional medicine, even longevity, and seeing the trajectory that it can have, came into it through their own story or someone near and dear to them's story, family member, close friend, whatever it is. It is a stunning reality. When you think you have healthcare and you realize that you don't have healthcare, you think you have health insurance and you realize you don't have health insurance, you realize that you really just have, kind of symptom management at the best, right? Nobody's really trying to figure out why you got this or even asking that question. So obviously you started to ask that question, and you look like you're free of psoriatic arthritis and psoriasis at this point in time. So walk us through that a little bit. That's going to be interesting.
Well, what happened was before I was diagnosed, about a year before, I was in healthcare, and I was marketing psychologists into medical centers. So I was meeting a lot of doctors, a lot of chiropractors, a lot of medical doctors. And it very quickly became apparent to me that certain doctors kind of are the embodiment of this fitness, wellness, proactive health philosophy. And what I found interesting as well is that many of them had no interest in business or making money or, marketing or any of these kind of things. They just wanted to heal people. And they would use whatever resources they had at their disposal to manipulate the system and the healthcare and the insurance in whatever way they could to be able to provide that kind of care for their patients. So I just found that interesting, and I was moving along from one office to the other. I was getting to know these doctors. I really liked some of them, and then I decided that I really liked their philosophy, and I bought some time on a local radio station. And I started interviewing these doctors because I wanted to create a platform from where I can introduce them and their model to other people.
Yeah.
So I started doing that, and I ended up doing a radio show for over 10 years on the local radio station. But about a year into it, this philosophy started to unveil itself. the power that made the body heals the body. Health comes from the inside out, not outside in. Your chronic condition is probably not an aspirin deficiency. So, I was like, all right, that sounds interesting. And then I got my diagnosis. So if I didn't go through a year of this kind of, training,
got it.
I probably just would have gone along with whatever I was offered.
Oh, I see. So you had perspective going into this based on that. Yeah, nice.
My mind was open a little bit.
Mm-hmm.
And so I was, I ended up interviewing, top doctors and experts and famous health activists like Suzanne Summers, Jack LaLanne, Mark Hyman, Carol Alt, who's a supermodel diagnosed with terminal reproductive cancer, who she ended up resolving that. Anyway, so this became a passionate journey for me. And one of the doctors I met by the name of Richard Lynchitz, he was diagnosed with terminal lung cancer 2 years before I met him. And he actually reached out to me because he heard I had this radio show. I started doing little events here and there, dinners and breakfasts and things. So he reached out and he said, listen, I started this practice. It's like a functional medicine kind of practice where I look to resolve the underlying cause of chronic illness. I have this little basement office. Why don't you come and we'll talk a little bit? Well, before he was diagnosed 2 years before I met him, he had one of the largest pain management centers in New York. And he was board certified in neurology, psychiatry, pain management, then later anti-aging medicine. And he was a remarkable man. So he got 2 years, 50% survival rate, alveolar carcinoma diagnosis. And so he retired from his practice and he started searching the world for anything that could help him resolve the underlying cause of his issue. I mean, he had a complicated issue that was pretty well progressed. But he ended up expanding his life for 15 years. And in that time, he transformed the lives of many, many people. I was one of them. So when we met, I said, listen, why don't we do this? I'll market you and I can be your guinea pig. I can barely walk. So maybe you can help me with that. So we started working together. He did a whole bunch of blood work. He does my digestive biome, my vitamin D levels, my mercury levels, a lot of different things. And then they started optimizing me. It was all cash, all out of pocket, very expensive, but the best money I ever spent because within 90 days, nothing happened. And then on day 91, my arthritis disappeared like I never had it.
Nice. Wow.
It's a miracle.